And welcome back to This and That, as we are now joined by Dr. Jay Sizemore, who's MD with infectious diseases. We're going to talk about and give you the facts when it comes to Ebola, because, as you know, we have the crisis or the scare. There's so many different words that we can throw out there. But when it comes down to it, right now as it stands, what is your update on Ebola?
Well, I think certainly the epidemic is still ongoing in West Africa. Here in the United States, we've been pretty fortunate to have very few cases. Certainly had the one returning traveler from Liberia in Dallas who infected 2 healthcare workers. Interestingly, there were 73 healthcare workers who weren't infected. None of the community contacts were infected, and none of his family members were infected. So again, we need to be cautious with this virus, but we don't need to be panicked. Certainly we have the one returning physician who's in New York who's infected. 2 nurses did well, so our response seems to be doing very well.
Now, of course, around town in this southeast Tennessee and northern Georgia, what is the chances of Ebola making it here, or what should we worry about when it comes to those chances?
Right. Well, I mean, I think certainly with international travel, there's always a risk. I think we're doing a good job in screening travelers who are coming back from West Africa. So I think overall the chances are remote, but certainly we have to be prepared in the case that we would see someone.
And being prepared, the precautions, you're down at Erlanger. Of course, Erlanger is doing everything they can to prepare for, but what does that mean to the general public?
I think the general public needs to be reassured if there is someone who would present to Erlanger that we are fully prepared to deal with that particular situation. We have a protocol, a plan in place. We have employees who are trained to work specifically with an Ebola patient, and we would do everything in our power to make sure that patient's appropriately taken care of, and if positively identified as an Ebola case, we likely would try to get to that patient to one of the biocontainment units across the country. In our case, probably Emory and the CDC in Atlanta.
Now, when it comes to certain cases that we've seen across the country, we've got the young lady that's in Maine that's kind of been fighting back that she's been in quarantine for 21 days, saying that maybe that is not necessary. Where do you guys stand on that? And, you know, if someone is infected with the virus, you know, how likely could somebody contract it from that person?
So the important thing to remember about Ebola is someone is not felt to be infectious until they're symptomatic. So the Infectious Diseases Society of America, our professional society, does not support mandatory quarantine for asymptomatic patients. Now, certainly I think we need to be cautious. Those folks probably need to avoid public transportation and other public venues. But I think we need to reassure the public that, in fact, that asymptomatic patient is actually at very low risk, if at any risk, of transmitting this virus.
Now, you guys have had roundtables with local government as well as state senators. What are those discussions like?
So last Friday, Senators Corker and Alexander got all 3 hospitals together, Memorial, Park Ridge, and Erlanger, as well as the health department, to basically review Chattanooga's preparedness for this virus and what they could take back to Washington to help us get even more prepared. So it was very useful conversation.
Now, your title and that you work with infectious diseases, obviously there's a lot more out there to worry about. And one thing that we sort of maybe tend to forget when it's all about Ebola is some of those other things to worry about that are just very common. And one being the flu. I mean, the flu is going to impact a lot more people.
Absolutely, and that's important. We are in the middle of flu season right now. Flu will kill probably over 30,000 people in this country this year. The vaccine's routinely recommended for everyone in this country over the age of 6 months, so we would stress that patients get out and get their flu vaccine.
I think one last quick question here when it comes to Ebola. If somebody were to contract it, even in the local community here, it's curable. You're going to be okay.
The patients who have been infected here in the U.S. With a high degree of supportive measures have done quite well so far, and that's reassuring.
Yeah.
Certainly not the case in West Africa, where over 50% of people who get this virus are killed.
And certainly our thoughts are with them too. So
absolutely.
We appreciate you coming in and talking with us today.
Thanks for the opportunity.
Setting some of those facts straight. All right, folks, here it is. For more information, you can contact the folks there at Erlanger or the Chattanooga and Hamilton County Health Department. Their phone number, the Health Department, 209-8220. And there's their website as well. Of course, you can always contact the folks at CDC for more information and facts when it comes to Ebola, or the folks down at Erlanger. Once again, Doctor, appreciate you coming in.
Thank you.
All right, we're going to take